It's a little overwhelming being here today. I arrived in Maine last night. It's been tremendous. I've met so many wonderful people in the last 24 hours, and I really thank you for the work that you're doing here and for coming out tonight and inviting me. I want to thank Robert for this painting. It's such an honor, and I really can't tell you how deeply it touches me that you've done this. I want to thank Maine AllCare for the work that they're doing to pass single payer at the state level here in Maine. You can do it. You need to believe in that. I want to thank Occupy for what they did last night, inviting me to come to their General Assembly and then the dinner that we had together in the discussion, and for the work that you're doing here to keep that Occupy energy alive, which right now is not the easiest thing to do, but you're doing it, and so I encourage you to keep that up. And I want to thank the labor unions that helped to organize the events that are going on these few days as well. Labor's got a tough job ahead, and you know, I'm glad to see that you're out here and that you're involved in this. I've had a real honor of knowing Quentin Young and being a friend of his, and he has served as a real mentor to me. Not only has Dr. Quentin Young been a lifelong supporter and advocate for single payer, he was also the co-founder and longtime president of the Medical Committee for Human Rights, which during the Civil Rights Movement recruited doctors to march with the protesters and to protect them and provide care for them when they were, when the police and other law enforcement were aggressive against them. He's been a real hero of mine. And Quentin has also been a teacher, and he teaches us a number of things. One of the things he says is that you know you have a movement when things start happening that you didn't plan. So the spontaneous kind of uprising of the Occupy movement is really exciting because we do feel that there is an energy now, that there is a movement for social change in this country, truly coming together. He also says, don't give people a lot of bad news and then don't give them anything to do about it. You know, give people more things they can do than you give them bad news. So that's what I'm going to try to do tonight, is to give you a little bit of bad news about, you know, where we are right now, and I think Robert did a fantastic job of that. I agreed with everything that you said. But also something that you can do about it, because we can't despair in these times. And when I was thinking about this talk tonight, I thought about the George Orwell quote and how amazing it is to be living in a time where, as he says, in a time of universal deceit, telling the truth is a revolutionary act. And that's the time that we're in right now. We're surrounded by a corporate media, which, with its ties to the concentrated wealth that controls our political system, intentionally trying to mislead us and encourage Americans to act against their own best interest. And so we need to counter that. And that's why Maine AllCare is so important, to be part of that education and the education that you're doing, Robert. So I was asked to talk about a little bit of healthcare reform versus healthcare, because I was kind of naive before 2009. I thought that when we were going to talk about healthcare in Congress, I thought we were actually going to talk about healthcare. I thought we were actually going to talk about what are the problems that exist in this country and what are the solutions that exist to address these problems. And so I joined with others, many others, as we met with members of Congress prior to the first hearings, and we said to them, you know, we want to talk to you about single payer. Here's all this great evidence of how well it works. And they said, great, that's really helpful, thanks. And we said, please compare single payer to what you're doing. And they said, of course we will, that makes so much sense. But when it actually came down to the hearings, they had no intention of considering single payer, because if they did, they would find that it's superior to what they put together in terms of the health law, and that it would make their corporate funders very unhappy. So the current situation that we're in the United States in terms of healthcare, as you may know, is that our healthcare costs are the highest in the world. We spend more per person per year than any other industrialized nation. But those industrialized nations actually cover everybody, or nearly everybody. And they have better health outcomes than we do. So for the amount of money that we're spending, we're getting a very poor return on our healthcare dollar. We have about 50 million people in the United States who are uninsured, And that level's not changing. No matter the small changes that we've been trying to make, that number is not changing. At its best, under the law that passed in 2010 called the Affordable Care Act, although I take issue with that, at the best, in 2019, they're estimating that half of the people that are uninsured will have coverage. And now the most recent numbers say that they don't think they're even going to be able to cover half of the people that are currently uninsured. So we're looking at nearly 30 million people continuing to be uninsured when this law is fully implemented in 2019. I just don't think that's acceptable. We also have a growing number of people in this country that are underinsured. These are people who spend thousands of dollars on health insurance premiums, but find when they get sick, their health insurance doesn't cover their needs. They're still financially vulnerable. And as a result, bankruptcy due to illness or medical costs, illness and medical costs are the highest causes of personal bankruptcy in this country, 62% of them. And 80% of those people that went bankrupt due to illness or medical costs had some form of health insurance. So health insurance in the United States is a very different beast than it is anywhere else in the world. And nobody else in the world uses a system like we use. Health insurers are the problem, and until we cut them out of the system, they add no value to it. They only take away from it because their bottom line is their responsibility is to create profit for their shareholders, and they can only do that by denying and restricting care. So until we cut them out, we're not going to be able to create a system that's universal, affordable, or guaranteed. And that's why we fight for single payer. It's not an experiment. If we had simply, during 2009 and 2010, compared the three systems that we have in this country already, because so many people are often like, well, we don't want to look at what they have, those other countries, they're different from us. That's kind of a misnomer. But if we look simply at the three systems we have here, we have a VA system. It's a truly socialized system that actually has a long-term investment in its patient population. They actually have very good health outcomes, and they're very efficient in terms of cost. If we looked at our traditional Medicare, which is a publicly financed through our taxes, but privately delivered system, which is what we're talking about, an improved Medicare for all, we would find that they are also controlling their health care costs, that their administrative costs are low, much lower than the privatized system, and that they improve health outcomes. When people in this country reach 65, the health disparities that exist start to disappear. Suddenly, when everybody's in a healthcare system and can actually get health care, those disparities in healthcare start to disappear. So this is not an experiment. This is proven. But if you look at the private insurance industry, whose responsibility is not about health, you see that it's the most expensive. It leaves people out. It puts barriers in place to care. And so why do we keep it? And the majority of Americans don't want us to keep it anyway. So that's kind of the current situation that we're in, spending the most, not getting very much for it, poor health outcomes, and a political system that's broken. And it was as a result of my experiences in Congress in 2009, 2010, serving as the Congressional Fellow for Physicians for National Health Program, that we saw so clearly what the game was about. And that everybody who advocates for peace, for social or economic or environmental justice, comes up against the very same obstacles. So if we continue to try to work on our individual issues, none of us is going to gain enough strength to overcome the stranglehold that there is on our political system. But if we actually work together and see that all of these issues are connected, then we can, if we act strategically with knowledge, learning from the past how nonviolent movements have shifted power in other countries, we can act intentionally to make a change in this country and to create the kind of world that we would like to live in, one that I think most people would like is peaceful, just, and sustainable. And that's why I got involved with the Occupy movement and started organizing the occupation of Freedom Plaza. So some of the lessons I just wanted to share with you that I learned when I was working as a congressional fellow in Congress. It actually, what I learned has the initials are ICU. So the way I think of it is that we're in a healthcare crisis, And we need the ICU, which for doctors is the intensive care unit. That's where you take patients when they're in critical condition. So very easy to remember. The I stands for independent. We need to, as we advocate for what we need, make our demands independent of political party. Dr. Martin Luther King Jr. never aligned himself with the Republicans or the Democrats. Even though they offered him money, he wouldn't take it. He said, I have to be the conscience of both parties. I have to hold whoever's in power accountable, and that's what we need to do. We cannot ally ourselves with their agendas. We need to focus on the issues independently of political agendas. We also need to be clear about what we're talking about. After the Affordable Care Act was passed, there was a lot of media attention and members of Congress going into their communities and saying, we've just passed universal, affordable, guaranteed health care. Well, the Affordable Care Act is going to be neither universal nor guaranteed nor affordable health care, even when it's fully implemented. So if those are the things that we require as human beings, we have to know what it is that actually would be universal, guaranteed, and affordable. And then this U stands for uncompromising, because for too long in this country, and especially around healthcare, we've been willing to accept what we're told that we can have. And I understand the dilemma, because I had that same dilemma when I was pushing for health reform at the state level. When you're told that all we can give you this year is an expansion of Medicaid, or all we can give you this year is a tax credit so that employers can afford health benefits for their employees. And you think, well, this small change is going to allow a few more people to have health care. It's very tempting to say, well, how can we turn that down? How can we deny that expansion of health care to other people? But if you step back and look at the big picture, what you'll find is that these tiny steps that have taken have not made any progress at all. Our uninsured numbers remain the same. Our healthcare costs are continuing to skyrocket, out of control. So at some point we have to say, you know what? We can't keep doing the same thing over again and expecting it to work. We have to actually demand a system that's based on the evidence of what does work. And that's a single-payer Medicare for all system. So what can you do? Well, I think that it's important for you to join this organization, Maine AllCare, to get out there and start talking to other people in your community, but also to build coalitions with other groups in your state, because it's all connected. In fact, if we get access to health care, we're still not going to have a healthy population unless we address all of the other factors that impact our health, the social determinants of health, and that's education. Does everybody in the state have access to a high-quality education? It's jobs with a living wage, being able to afford a decent life. Do you have a home, or are you being foreclosed on? Do you live in a community that's free from violence, that's free from toxins, or is your environment around you poisoned? Do you have clean water? Do you have access to healthy food? Are you treated with dignity? Are you respected? All of these things impact our health. And if we want a healthy society, we've got to work for all of those. And that's why everything is connected. And that's why we need to be joined together in solidarity to push for what we really require as human beings. So I hope that we'll take a long view in this struggle to see that at this point in our country, we need to be working to build a mass movement and to educate each other. And that's going to take time, it's going to take work, but that's the only way that we're going to break out of this situation that we're in and get where we need to be. So I'm really pleased to see that each of you are here tonight. I wanted to share one story because I didn't realize there would be so many psychologists and psychiatrists in the room. But my dear friend, Dr. Carol Paris, is a psychiatrist in Maryland, and she was actually one of the people that was arrested with me in Senator Baucus's hearing, as well as she followed me and got arrested again when we were trying to give President Obama a packet of information about what real healthcare reform would look like. And after that, we started traveling with a group called the Mad as Hell Doctors. And as part of this tour, we would get on stage and say, I'm mad as hell because, well, Dr. Paris would say, I'm mad as hell because all of my patients are pissed. She came up with a new diagnosis. It's PIISD. It stands for Private Insurance-Induced Stress Disorder. And it doesn't just affect our patients. It affects providers as well, because we're all fighting with private insurance and we all are stressed by our interactions from them. And so she made up a big sign that said, got pissed? get the cure, improve Medicare for all. So it's important that we take seriously the work that we're doing, but that we also maintain a sense of humor, that we support ourselves through this struggle, because it is a long-term struggle. And so I thank you for being here tonight, and I thank Maine AllCare.